Night suggests the coronavirus was circulating in Washington 4 to 6 weeks before the first community spread case was detected on February 28th. That estimate is based on genetic sequencing of COVID-19 samples from the Unified Command State Emergency Operations Center. Hospitals all across the country are scrambling to treat the high number of COVID-19 patients. But here in Spokane, that's not the case. Hospitals are actually kind of calm right now. Our Maher Kawash takes you inside Sacred Heart Hospital tonight to see how they're handling it all.
Providence Health reassured us today they're good on supplies for now. They won't tell us the exact number of ventilators they have on hand right now, but they did say they have enough to handle the worst case scenario.
We have no capacity issues. We have lots of capacity care for people that are sick.
Providence Health is leaving no room for discussion. Hospitals in Spokane are prepared to handle COVID-19 patients. There are more than 600 beds just at Sacred Heart Hospital, and they could even add more if it's needed. Protective gear also not a concern, at least for now.
The last thing that we want to get into is where you have caregivers and staff that don't have appropriate PPE to care for high-risk patients, and I feel that we're not there.
2 pairs of gloves, a gown like this, an N95 mask, a face shield, and a hair cap. That's everything they need to wear just to treat COVID-19 patients.
We can use a mask up to 5 times as long as its integrity isn't compromised.
They only use the N95 mask when a patient needs something like a breathing tube put in. Otherwise, they can just use a simple mask like this. Providence policy is that those masks can be reused up to 5 times unless something gets on them. The gown and gloves are not reusable. Right now, 15 people in Spokane County are in the hospital with COVID-19. Many of those patients just need routine care in a normal bed like this.
IV fluids and supplemental oxygen. This would be pretty similar to the setup that they would have.
Others may need a ventilator to help them breathe. Dr. Getz says these are so important because breathing takes quite the toll on our bodies. Once you help a patient with that, it allows the rest of their body to recover just a little bit easier.
I'm told many people who test positive for COVID-19 are just self-isolating at home with those symptoms. Now, for the patients that are released from here, they're expected to stay home and out of the community for at least 14 days symptom-free. Reporting from Sacred Heart Hospital tonight, I'm Maher Kawash, 4 News Now.